Do you limp when you walk? If you limp when you walk and you'd like to find out how to stop, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain some of the most common reasons why people limp, a few of the most common limping patterns, and how to fix each of them. Now, first of all, why do people limp in the first place? A lot of people think that limping is due to pain, and sometimes it can be. But limping can either be a cause of pain or an effect of pain. Now, in the case where limping is the effect of pain, it's actually a productive and good thing to a certain extent. For example, if you're out hiking in the woods and you roll your ankle, you don't want to put weight on it, but you still have to get back to safety. And so your body reflexively and automatically changes your walking pattern to allow you to get back to safety without causing more damage to your injured body part. Now, the funny thing about pain is that it doesn't actually mean that you've injured a body part. It's just that there's the potential to have damaged it or the potential to further damage it if you continue to do the things you were doing. And so it's a warning signal telling you to stop. And when you have pain, for example, in the case of a sprained ankle, it tells your brain to change your walking pattern so that you don't potentially further damage that. But the longer that you do that, it can reprogram your nervous system, and over time, that can become a permanent and lasting habit. And sometimes, even after people have had an injury, say to their knee or their hip, and it gets better, or after they've had a surgery, like a joint replacement, they find themselves continuing to limp because it's like changing the programming inside your brain and to some extent your spinal cord. If you think about walking like a computer program, it runs automatically without you having to cognitively think about it. And that's the reason why you're able to walk and chew gum or walk and have a conversation with a friend without tripping and falling. Because your brain, and again to some extent your spinal cord, runs these motor programs where they automatically run the walking program. But when you've started to limp and you've done that for a period of time, it reprograms that computer program so that the limping pattern becomes the normal pattern. And it stays that way until you rewrite the program. So even after the injury is healed, even if your limping was the effect of an injury, it can actually become a lasting issue. And that's a problem because limping can also be the cause of pain. That if you're limping because of some past injury and that just becomes your new walking pattern, then you can develop muscle imbalances that lead to future injuries. And so it's important that if you have a limp, to stop it as quickly as possible. Now, in the case of an acute injury where you've actually injured a body part, it's a good idea to use an assistive device. That may be crutches, that may be a cane, that may be a walker. But the longer that you continue to limp to take weight off of the injured or potentially injured body part, the more likely it is that it's going to cause a permanent change to your walking pattern. Now, a lot of people have fear that using a cane, particularly older people, have fear that they'll become dependent on it and that it will make them weaker. But the opposite is actually true. That if you have pain in a body part, your brain reflexively shuts that muscle off. And so you actually get weaker by limping because you're using other muscles or you're using compensations in your body weight to avoid using that injured body part. And so limping actually makes you weaker. Conversely, using an assistive device like a cane, it allows you to use just as much effort or just as much force out of the muscles as you're able to comfortably without causing further pain or further damage. And so it is a good idea to use a cane or crutches or a walker temporarily if you can't walk without a limp until you're able to walk normally again. Now, I've got other videos showing you how to walk with a cane, so I'm not going to repeat that in this video. But next I want to discuss 3 of the most common limping patterns that I see in people. Now, this first one is by far the most common, and that's a side-to-side problem. For example, either leaning too far to one side or going too far to the other side. And those are usually due to hip weakness problems, but they can be from different conditions. For example, if you have a gluteal tendinopathy or a tendinitis of the muscles and tendons in your hip that run over the outside of the hip, it hurts when you hold your body weight level. And so your brain will either reflexively shut them off and allow you to tip over that way, or you can use leverage of the weight of your trunk, lean over to the same side so that those muscles don't have to work as hard. Now, if you do this type of pattern, that can lead to a bursitis or an IT band syndrome over time. Conversely, if you do that other type of pattern, that can lead to a lower back problem. And so it is really important to stop that limping problem. And again, using a cane, ideally in the opposite hand, to help steady yourself and allow you to balance over that hip is a good idea in the short term. But in the long term, if you're having a side-to-side limping pattern, whether you're leaning to this side or whether you're leaning to that side, you want to practice balancing on one leg and being able to keep your pelvis level without having to lean your trunk weight one way or without allowing your pelvis to dip down the opposite way. And so a good way to practice that is just standing on one leg with your pelvis level. If you need to use a cane or hold on to a chair or a wall initially, that's okay. But you want to think about squeezing the muscles on the side of your bottom or on the side of your hip to help hold your belt line level with the floor, and then holding that for 5 to 10 seconds initially and working up. Initially, you just want to do what you're able to do comfortably without causing pain, but then working your way up to holding for 30 seconds or so. Research shows that people who are able to stand on one leg without holding on to anything for 10 seconds or longer are much, much less likely to fall in the future as well. And so being able to balance is really, really important, especially for seniors. So that's the first problem, the side-to-side problem, and that can happen because of hip pain or commonly after a surgery like a hip replacement. Now, the second walking problem is what's called circumduction. And what that means is swinging your leg around, keeping a stiff leg if this is the sore or injured side, and kind of swinging that leg around to the side. That often happens when someone has either knee pain or they've had a knee surgery where they have a bandage or a compression around it, and it keeps them from fully bending their knee as they're swinging it through. And so as an alternative, they learn to kind of swing the leg around so that they don't have to bend their knee as much as they're swinging it through. But again, that can contribute to future problems down the line. For example, you're throwing your body weight over that way to help swing this leg around, and so it can create hip problems or it can create back problems. And so you don't want to do that. And initially, after something like a knee replacement or a knee surgery, you do need to regain your knee range of motion, but you actually don't bend your knee that much when you're walking. So you don't need a whole lot of knee bend to be able to walk normally. It's just reforming a habit. And one of the easiest ways to break that habit of circumducting your hip or swinging your leg around to the outside instead of bending your knee is just to think about pushing off the toes of your back leg. Many people are taught to walk heel to toe, but what that kind of does is forces you to think about hitting with your heel. If you instead push off of your toe, so instead of pulling forwards with the heel of the front foot, think about pushing off of the toes of the back foot. That creates a natural knee bend, and you almost naturally swing your foot through. So if you are finding that after a knee injury or a knee surgery that you're having trouble swinging your leg through and getting your knee to bend when you walk, think about pushing off the toes of the sore foot, and that'll create a natural tendency to swing that leg through as you're walking. So that's the second limping pattern. Now, the third problem is sort of a wide base gait where you're teetering side to side like that. And that, again, is often due to balance problems. You sometimes see that in people with neurological diseases, or sometimes you'll see that just in older people in general. But typically that has to do with having poor balance. If you give yourself a wider base of support like this, it's harder for your body to fall outside of that base of support. And it is good to keep a wide enough base of support. You don't want to keep your feet too narrow like you're walking on a tightrope or walking on the runway. But you also don't want them really, really wide apart. And so again, that a lot of times comes down to balance, in which case standing on one leg and practicing standing on one leg is a good exercise to help with that, so that you are a little bit more stable on your feet and you don't feel like you need to walk quite as wide. But then when you're actually walking, a good way to think about fixing that is to try to keep your feet in line with your hips. So not going out too wide, but not going too narrow, and then pushing off the toes while keeping the feet the same width as your hips. Now, another thing people commonly wonder about is, well, if my toes naturally turn out like this, do I need to force them inwards? And the answer to that is no, that people aren't built all the same. Some people have hips that naturally turn out, some people have hips that naturally face straight ahead, and some people have hips that cause them to toe inwards. So wherever your normal standing pattern is, if you move around and then just let your feet fall where they naturally would fall, that's probably the pattern that you're going to walk in. So not everybody needs to walk with their feet pointing straight ahead. And if that's not you, you can actually create more problems by forcing your feet to go somewhere where they don't naturally go. And so find the pattern where you would normally stand in, and then just walk with your feet in that same orientation. So hopefully you found this video helpful to help you walk without limping. And if you are in the St. Louis area and you need some more help to relieve pain or walk more normally, we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.